Hello, I am Darren Hawkins, Head of FM and Property Management Key Accounts Hygiene for PHS. And my podcast today covers the subject of hands, face, space, but what about the air we breathe? I'm also joined by Ashley Shields, the PHS air quality expert, to discuss later the findings of some research that PHS undertook on this subject and touch upon our solution. But before we do, evidence suggests the UK vaccination programme is taking hold across the country. Results show more respondents are starting to believe that employees could return to the workplace in greater numbers than many initially expected. Encouragingly, the latest survey feedback shows sustainability, along with health and well-being, have been key areas of investment across industry over the past 12 months. However, could the initial excitement to get back to the office wane if employees are not convinced that their workplace or indoor setting is hygienic and safe? We have all been familiar with the slogan of hands, face, and space, but it is only recently that we have seen the addition of fresh air, and this is what we want to explore today. Due to the unique nature of PHS, which has more than 120,000 customers and services 300,000 premises, we understand the impact of COVID-19 on different regions and different sectors of the UK economy. And with this in mind, PHS commissioned new independent research to find out how people's behaviour has changed and reveal sentiment around working or visiting indoor premises. But worryingly, our research found that 68% of the people we surveyed were concerned about catching COVID in indoor places. The independent research we commissioned, with over 2,000 people taking part across the UK, asked how they felt about spending time indoors and how their behaviours have and might change going forward. Our research showed that broadline 68% were concerned about catching COVID-19 in indoor environments, 23% are very concerned, and 54% of the people we surveyed said they are more concerned now than before. This research therefore shows a clear concern about catching coronavirus in indoor settings, and with premises starting to reopen, how we will all need to make consumers, employees alike, feel even more protected about returning to our facilities. We will need to encourage customers to have the confidence to set foot in our offices, shops, and restaurants, again to generate some much needed revenues for our businesses and the economy. Businesses must adapt in order to accommodate the requirements that consumers and employees will have moving forwards. And it's also fair to say that a significant proportion of people are or will avoid premises because of a lack of trust or knowledge about the measures being implemented by businesses. But the good news is that they are addressable. Some of the main reasons why people are avoiding indoor settings are because 51% didn't want to risk catching COVID-19, 26% don't trust the measures in place are enough to protect them, 25% have been worried about passing any germs on to someone else unknowingly, with 23% don't know enough about what the location has done to make it COVID-19 safe, with 19% not wanting to sit wearing a mask. The research uncovers a trend of people avoiding indoor settings for entirely avoidable reasons. The measures organisations are implementing need to be comprehensive, robust and trusted, and once the right measures are in place, they need to effectively reduce the infection as much as possible. Ashley, I would like to bring you in here and ask you a number of questions around clean air environments, especially around official reviews on the airborne threat and what can be done to give people the confidence they need returning to an indoor setting. So can I start by asking you, can you give us an insight into air quality challenges and the importance of air quality and treatment to make the environments and spaces we share as safe as possible?
Believe it or not, Darren, indoor air is up to 5 times more polluted than the air outside. And this airborne threat isn't new. COVID-19 has simply made us more aware. As a society, we'd learnt to live with viruses such as influenza which kills thousands of people every single year. On average, pre-COVID, there were 50 million influenza sufferers in Europe, which is a staggering amount. Another huge challenge is asthma and allergies. Allergy UK estimate that over 20% of the UK's population are affected by one or more allergic disorders, which is one of the highest prevalence rates of allergic conditions in the world, and poor indoor air is a major factor. Various indoor building materials, new furniture, fresh paint, dust mites, mould spores, and in a home environment, pet dander are all a major cause of allergic reactions. So what can we do to help? The most effective way to reduce the airborne threat is to clean the air and remove germs, viruses, and allergens using air purifiers. In a commercial setting, the long-term benefits of clean air are clear. Improved productivity, reduced absenteeism and presenteeism, creating a more positive, health-focused environment, and even reducing common complaints such as odour will improve the safety and well-being of our building's occupants, Darren.
But one of the slogans I think we're all familiar with that we've seen pretty much throughout the coronavirus pandemic is regarding hands, face and space, and of late more about fresh air. But what about the air that we breathe? What hygiene measures actually can help reduce the spread of the COVID-19 virus, but in fact any airborne contaminant?
Well, we've all heard that message of hands, face and space and fresh air now. And these are important aspects in infection control, and they're combated by hand washing, masks, social distancing and improved ventilation. I think now, though, it's well recognised by all professional and scientific bodies around the world that the airborne issue is a real and significant threat. There's a lot of data and research out there which backs that up, and some of these organisations, such as the CDC in the US and SAGE, our own government scientists, advocate the need to clean the air and also advocate doing that using commercial grade air purifiers or air cleaning devices.
But specifically, if we're looking at the airborne threat of COVID-19 and its transmission, how can we avoid that?
So, an infected person enters a room, unknowingly breathing out infected aerosols not contained by masks. Masks are actually great at preventing the larger droplets that we emit when we cough or sneeze, but do little to stop the much smaller aerosols. A recent study showed that 1,200 aerosols are released for every droplet, and because of their size, these infected aerosols linger and disperse around the room and can remain circulating in the room for a number of hours after that infected person has left. The most effective way to avoid or prevent transmission is to clean the air and remove the virus.
But how can businesses be more proactive, Ashley, in the fight against COVID-19 and really safeguard ourselves for the future, which is obviously what a lot of people are concerned about from the research that we've done?
Yeah, well, we're constantly surface cleaning now and washing or sanitizing our hands, but it's proven that air is more likely to transmit viruses than surfaces are. We should therefore be including air within our overall hygiene strategy and take a much more proactive approach to protecting the health of our buildings, occupants and visitors. Now that our facilities are starting to reopen and we want them to be as safe as possible, and even in the last 48 hours, there has been coverage in the press around the importance of improving air quality in hospitality settings, as well as offices, schools and hospitals. I think, Darren, in the short term, it's about preparation for welcoming staff and visitors back, and in the medium to long term, future-proofing our facilities and shared spaces.
Okay, so Ashley, what is the PHS solution for air purification?
Well, PHS have been providing clean air solutions for over 10 years, and it's fair to say that the last 12 months have certainly been the most eventful. COVID-19, as I mentioned previously, has changed people's views about indoor air quality. For months, the CDC in the US, ASHRAE, and healthy building scientific advocates have recommended portable air cleaners using HEPA filtration for protection against COVID-19. And PHS's Aeromax range of air purifiers have been proven to capture 99.99% of airborne coronavirus. The Aeromax actually uses a 4-stage filtration process and patented EnviroSmart technology, which uses dual self-regulating laser sensors to measure sound, motion, and air quality, ensuring that the busier an environment is, the harder the units work to filter the air and remove those airborne contaminants as quickly as possible. Aeromax is the most powerful commercial wall-mounted air purification system available, achieving a minimum of 3 full air changes every 60 minutes. This means it can totally clean the air in a room every 20 minutes, Darren.
Thanks for that, Ashley. So I really think, in summary, even though the airborne threat is real when you talk about coronavirus in isolation, it's also true of any airborne contaminants that are present in any indoor setting. Businesses really need to take a more proactive approach to long-term hygiene strategies, as our research shows that, whether you're an employee, a visitor, or consumer, you are seeking confidence that any indoor setting you visit has taken adequate measures to address the well-being of anybody using those facilities. If you would like more information on what we've discussed today on this podcast regarding our research or the Aeromax solution, then please email fnpodcast@phs.co.uk for further details. But thank you for listening.